Hello, my name is Nick Baker. I grew up about 5 minutes from here. I live here now since graduating from UT in December. And my question concerns the tax exemption for employer insurance. If I understand this correctly, there's a tax exemption on that insurance that individuals paying or buying into insurance don't necessarily always get. And I knew that this was originally eliminating tax exemptions so that everyone pays the same rate. It was originally part of Obama's idea, and it was also maybe being considered in the bipartisan group in the Senate. But then the Democrats in the House got leaned on by unions who currently get very cushy packages, and that idea was essentially killed by very meetings with other leaders. And I've read a lot of articles on the left and the right that said that this at least should be considered. And so my question is, first of all, is this still in the running as an idea to pay for a part of any health care package that gets passed? And I wanted to know from the doctors and from the insurance groups if they consider this to be a good avenue to explore.
Let's start off with the insurance group. First go around.
I think I know what you're saying. It's sometimes hard to hear back here, but there is an inequity in the tax system right now that individual medical insurance is not tax deductible like your group medical. Now, is that part of what your question is?
That's part of my question.
Okay, and we have been fighting for years for individual medical insurance to be just as deductible from your taxes, the premiums that you pay for individual medical, to be deductible from your income tax, just like your group health insurance is.
Any comment from the medical professionals? Jonathan.
I just want to follow up on that. That's exactly the point. Thank you for the information that I made early on. Is we give small businesses the opportunity, the tax competitive opportunities that corporations have. Corporations, large businesses deduct the cost of private health care of their employees. There's no reason why small business can't do that as well.
The master's degree is federal tax law. It should be very simple. Whoever pays the premium gets to deduct it. Sure, that's
Under the current system, your employer gets a deduction for the premiums that he pays off of his business expenses. And most employers in our state pay somewhere between 50 and 100% of the employee coverage, and some of them pay a portion of the dependent coverage. If this bill were to pass, as it is right now, the employers would be required to pay 72.5% of the employee's coverage and 65% of the dependents. And that would probably put most of the small employers out of the health insurance business for their employees, which would mean they would be subject to that 8% tax.